Good Monday afternoon, everybody. It's kind of a gray, chilly day out there. Forecast for the rest of the week, that was a lot better. So I got a couple of things to talk with you about today. Of course, we're going to talk about COVID. I'm going to just talk to you for a second about tiny houses again. And then, of course, we'll take your questions. So with regard to COVID, the city of St. Louis, we had 142 positive cases yesterday. Our average number of positive cases per day over the last 7 days has been 134. That gives us 44 positive cases per day per 100,000. And that's been pretty steady for us over the last few weeks. It was 42, 42, 46, 44 right now, so down just a little bit over the last few weeks. That number, compared with other counties around us, is significantly better. Our number's 44, St. Louis County's 66, St. Charles is 77, Jefferson County's 101, and again, that's the number of positive cases per 100,000. In the state of Missouri overall, it's 66. So we are faring significantly better. State of Missouri is 50% more per 100,000 than we are. Still too high, of course, we know that, but those are numbers that we've been watching very carefully because we believe that the more compliance we get with the mitigation strategies of mask wearing, social distancing, washing your hands, and keeping your pod or your group really small, the better results, the fewer people who will test COVID positive. So our numbers been pretty steady. I think that indicates that our residents and our businesses have continued to try to comply with those mitigation strategies. And so while we want the number to be lower, of course, we're comparing ourselves to all the counties in the surrounding area, and our numbers are better than any of theirs. So that's good. Couple of other things, talking about number of people in the hospital. And as you all know, I think if you're a regular viewer, these hospital numbers are 2 days old. So these numbers are really from Friday, most likely. Number of people in the hospitals has gone down a little bit. We were, for a while, back at the end of November, early December, we were up at number of positive and suspected positive people in the hospital, up to almost 1,100 people. Today we're at 939, 865 COVID positive, 74 suspected or probably COVID positive. So we're at 939. So it's down a bit. It's still way too high. Our hospital staffs are still being very extremely challenged by the situation. And so hopefully we can sustain those, continue to have those numbers go down. People in the ICU, 194 positive, 13 more suspected, for a total of 207. That's not quite the all-time high, but getting close to it. And then number of people on ventilators, 119. Again, it's a tiny bit better than it has been for the last 10 days or so, but still it's way too high. And 90 people discharged from the hospital 2 days ago. So our numbers are still high. I do believe, and this is anecdotal, I do believe that for the last 2 weeks, I guess it is, 2 to 3 weeks, that we've really been reminding people, harping on people to follow these mitigation strategies. I do believe that more people are more serious about following them. And so that's the good news. That will pay off a week to 2 weeks down the road. Of course, we're all concerned about Hanukkah, Christmas, New Year's. Hanukkah actually starts this week. Christmas and New Year. So we're all continue to be concerned about that because people will just naturally get together more than when it's not a holiday period of time. And the result of that is likely to be very, very serious. So those are our COVID numbers. One other thing, you know, and this is on the health department website, but we talked about hotspots, and we still do have hotspots in 6311. Let me put my glasses on here. Well, this map is by wards, and what is this? This is neighborhood boundary. Okay, let's talk about it by ward. 16th ward, 23rd ward, 14th ward. I don't have the zip code map here today, but most of you know where that is, and I think the zip code map is on. Do I have it here? Okay, don't have it in the map form. It's on the back. Okay, here we go. It's on the back. So still the highest numbers in 63116, 63109, 63118, 63111, all the far south zip codes. The other thing, though, that is showing up is a pretty bright hotspot in, basically this is DeBoliver Place, is the neighborhood. It's 63112 zip code, but more cases, kind of, it shows up on the map online in yellow. And so we are seeing something going on right there in DeBoliver Place, which is roughly from that neighborhood boundary is from Union. Let's see, Union to what? Union to DeBoliver. There we go. And then Lindell to Delmar. So it's a very dense neighborhood. So something's going on there. So that's it for COVID. I'm sure we have some COVID questions, which we'll take those in a few minutes if we can. I want to skip over for a minute just to talk about the tiny houses. We've talked about these a number of times, but this morning, about noon, I was at the site at 900 North Jefferson because the first tiny houses were being delivered. And by the end of the day today, we'll have 20 or 30 tiny homes there. And they're not quite ready for occupancy. We're going to install smoke detector in each tiny home. We're going to put the heating and air conditioning unit in it. We're going to get it hooked up to the electricity. We've got a floor covering that needs to go down. But they're being put in place now. They're being leveled. And each one of them will end up with an address. They'll be numbered 1 through 50. Ultimately, it'll be 50. And so sort of like an apartment number, maybe, if you were in an apartment building, but these are tiny houses. So we're working on all of that. New mattresses are in. They're not at the site yet. But so we're going to be working hard all this week to get the tiny houses set up. Our human services department is going to work with the continuum of care. They're figuring out what individuals will be most suited to go into the tiny houses. We know this is not permanent. This is temporary, transitional housing. So we would hope that someone would go into the tiny houses that would then ultimately be able to be placed in an apartment and get back on their feet. So that was kind of exciting today. I think we're going to post a couple pictures maybe or a video a little bit later if we haven't already done so. Have we already posted it? We haven't posted it yet, but we'll post it later this afternoon. They look great, and I think it's going to be a really nice little community that is going to be very conducive to moving people into permanent apartments. So that's the tiny houses. And I think that's the only two subjects I have today. Was I supposed to talk about something else? No, I was trying to forget. But anyway, let's take your questions.
A couple of questions, just summarizing some general questions from folks who have written in about additional restrictions moving forward.
Mm-hmm.
Is the city any closer to implementing additional restrictions, including acting on the recommendation about possibly putting all businesses at 25%?
So that's still under consideration. If, I don't know if you were on Friday when we talked about this, but a lot of businesses just can't, they can't keep the lights on and have the staff come in for 25%. We are considering it, but as you heard, if you were on earlier in the program here, City of St. Louis numbers are still much, much better than any place else in the region. You know, the rest of the region is at least 50% more cases per 100,000 than the City of St. Louis. And in some cases, you know, 120 or 30% more. So we're really working hard to get compliance with the restrictions that we have in place right now. And so at this point in time, I think we're going to let it sit for a bit.
You talked about upcoming holidays, Mayor. We did get a question about how the city and the health department are advising folks to stay safe during shopping season, and what are ways people can report overcrowded stores and lines they might see.
Well, you can report overcrowding or people not wearing masks, not following the mitigation strategies. You can report that by calling 622-4800. You got to give the address and you know, the pertinent information. You can also report it on Twitter at STLCSB, or you can go online on the city's website. It's right on the homepage. It's Make a Complaint. You can upload pictures and provide some good information that way. That's actually a great way to do it because of the ability to upload pictures. So you can report issues that you see in that way. What do we advise in terms of holiday shopping? Well, I don't know about you all, but you know, I'm doing a lot of holiday shopping from my kitchen table online, and you know, it's convenient on one hand, and I think it is a safe way of doing it this year. I do like to go out and look around in the stores some because it gives me ideas that I may not have had otherwise. But if you do that, which is of course fine, just wear your mask and stay 6 feet apart. I mean, you can do that for yourself. Just, you know, step back. And I think I observe a lot of people doing that. Now, I haven't been out shopping that much, but I was out a little bit on Saturday. And it wasn't crowded like it usually is, you know, around Christmas time. And people were social distancing and wearing a mask. So I think that's really the key. And we all have to kind of do that for ourselves.
Kevin has a question about something that I think we talked about on Friday, but maybe worth repeating. Will bars be allowed to be open past the 11 p.m. curfew in the city on New Year's Eve?
Highly unlikely. I know that's not the answer you want, but I seriously doubt it. And our numbers are not going to be that much better by New Year's Eve. And you know, what of course nobody wants to have is a big New Year's Eve super spreader event. So no, I do not see that happening. If I'm wrong, I'll admit it, and you know, you all can tell me I'm wrong, but that's not going to happen.
Adam has a question about if there's any timetable about larger business conventions, traveling trade shows, those sorts of events being allowed to happen in, quote, the foreseeable future.
Well, I think they will be happening in the foreseeable future, but not in December, not in January. You know, we have these vaccines that are beginning to come online. The FDA is meeting on Thursday, I think, to consider whether or not to give emergency approval to the Pfizer vaccine, and then Moderna is coming right behind that. Johnson & Johnson has one, and AstraZeneca. So the vaccines are very promising. Even more promising than the vaccines is vaccinations, meaning we have to get people to take the vaccines. Personally, I'll be happy to take the vaccine. But I understand that some people do have concerns about the vaccine. For me, the concern about getting COVID and getting extremely sick is higher than my concern about taking a vaccine. But everybody will make that decision for themselves. So we have the vaccines on the horizon, which, you know, folks are saying, and when I say folks, Dr. Fauci, the experts are saying, healthcare workers will get it first responders in that first round, also nursing home patients and staff, so congregate living facilities. But that's going to take a little while because this vaccine is going to roll out more and more doses per week. And then by spring, you know, now what is spring? Is it March? Is it April? Is it May? In that time frame, it should be becoming available to the general public. And so that is, you know, that's really the thing that will get us to having larger conventions. I mean, if our numbers are go way down through a combination of behavior changes and mitigation strategies and vaccines, well, then we'll be able to have large conventions again.
We've got a couple of questions about COVID and schools. First question is from Cassandra Mayer. Does the city and the health department help monitor private schools in the city? And do they also have to quarantine if a positive case is uncovered in a private school?
So, yeah, quarantining, if you've been exposed, and then you will quarantine for 14 days since your exposure. That doesn't matter who you are, whether you're a private school or a public school, or whether you're a business, no matter where you are. But the people that have to quarantine are those people who have been exposed. Probably that's not the whole school, but you know, we do know that you know, sometimes it's a whole department, or sometimes it's, so yeah, I mean, private schools are no different than any place else. If they have a positive case, which undoubtedly they will, because this is everywhere in the community, then anyone who's been exposed, meaning for 10 to 15 minutes without a mask within 6 feet, that's certainly an exposure. Those people would have to quarantine, whether they're teachers or other students.
A couple of testing questions, Mayor. The city has encouraged folks to continually get tested, obviously. Has it overwhelmed the labs, and has it caused the results to be, the turnaround time to get extended, or it should be longer?
Well, we absolutely encourage people to be tested, especially if you think that you have been exposed, or if you've been engaging in some maybe riskier than you should have, or then we'd want you to behaviors, being in large groups, traveling, that sort of thing. So we want you to get tested. In the city of St. Louis, let's see here. We have had, what's our total number of tests? Thank you. Somebody pointed to it. In the city of St. Louis, there have been 177,000 tests given. Now, we have 300,000 people in the city. I know a lot of people have been tested more than once, but still, this is a large percentage of our population that has been tested. Of those 177,000, I'm rounding these numbers off for you, 16,000 have come back positive. Now, that's the number of positive tests, but there have been 13,451 have been unique people, individual people. So obviously you can see that some people have tested positive more than once. So 13,451 people have tested positive in the city of St. Louis. Of the 177,000 tests, 160,000 of those tests came back negative. So yes, get tested. And our testing sites are online. We have lots of them, and it's not just the federally qualified health centers, but hospitals are doing them, doctors' offices are doing them, Walgreens, CVS is doing them. So get tested. And what was the second part of that? Oh, you wanted to know how long is it taking the test to come back? Happen to have that. So around Thanksgiving, it was taking longer to get the results back because we did have everybody was getting tested. So, when everybody's getting tested, it takes a little longer to get it back. Last week, though, the average was 4.28 days. So let's call that 4 days. Earlier in the week, right after Thanksgiving, it was taking a little more than 5 days. During the periods of time where, I'm gonna look back here a little bit, we were down in the 3.5 days category earlier in the year in October and November. Now we're just a little bit over 4 days, so it's not too bad. I mean, everybody wants the test back as quickly as possible, because once you get a test, you really should quarantine yourself, self-quarantine, until you get the results back. Because getting the tests and then being out running around, you may be getting exposed there again. So sit tight until you get the results of your test back. And then, of course, if it's negative, you haven't exposed yourself to something else in the meantime. So.
Question about hospitalizations, Mayor. Jeff wrote in and asked about the city's hospitalization rate. According to the task force, the rate of folks from the city going to the hospital has been steadily climbing over November. I want to know if that sort of metric comes into consideration.
All the metrics come into consideration. How many city people are in the hospitals right now? Did we find that? I'm sorry. Is that on our website? Oh, that's on the pandemic task force. What's the answer?
So
We don't know. That doesn't tell us how many people.
November 24th, that's our rate, but it doesn't tell you the total number of people.
Yeah, it doesn't. Yeah. So about 2 weeks ago, there were about close to 1,100 people in the hospital. 89 of them were from the city of St. Louis. I don't know what that number is today. I didn't look that up before we got here, but because the number of positive cases in the city is much lower than any place else in the region. You consider Jefferson County is having 101 cases per 100,000 people. The city of St. Louis is having 44. That's a much lower rate. We also are having lower hospitalization rates.
We did get a follow-up question about the vaccine from Robbie, Mayor. So Mayor Quentin Lucas in Kansas City and the Kansas Governor Laura Kelly also agree they'll be getting the vaccination publicly so people can see that it's safe. Do you think that that is a good idea, and is it something you'd be willing to consider doing it publicly to encourage trust in the new vaccine?
Well, I definitely would be willing to do. I got a flu shot in public, and that's I would definitely be willing to do that. I will say, however, that I don't want to take a vaccine that should be going to a healthcare worker or a firefighter or law enforcement. I don't want to take a vaccine away from somebody else who needs it even more than I do. But yes, I would certainly take it in public.
We have some CARES Act questions, Mayor. Do you have an update from the state on CARES Act funding getting to additional people in the city? And what is left of our original allocation of CARES Act money?
So there's no direct subsidy to people from the state that I'm aware of. You don't have anything else on that, do you? Okay.
Not in front of me.
Okay. From the city's point of view, I looked at the report this morning. We're giving a report to the Board of Aldermen tomorrow morning. I think the report that I saw said we had $100,000 left, $110,000 left that had not been committed. And, some categories are over and some categories are under, but we are going to spend every dollar of our CARES Act money.
I think you may have talked about this when you mentioned the tiny houses, Mayor, but David's question was the occupancy component. Who's eligible and when do folks begin able to move in?
So we expect some folks to be moved in within the next couple of weeks, certainly by the end of the month. And it's our Homeless Services Division working with the Continuum of Care. They have a list of homeless folks, and they will be choosing the people that are most ready to live in a tiny home on their own, and they'll get them from wherever they are now. They might be in congregate shelter, they might be on the street, to get them into the tiny home. So that'll be something done by our Homeless Services Division and the Continuum of Care.
And I think last question for today. So over the spring and the summer, the city expanded their homeless outreach with shelters and motels. Is that continuing through the cold and helping to provide shelter during the winter?
It is, absolutely. We added 300 and, round numbers, 350 beds, and that will be continuing through December, January, February. And it's a very important component of providing services to our most vulnerable populations. And so we're happy to do it.
That's it for questions.
That's it for questions today. Thank you all for being with us. We'll be back and talk to you on Wednesday. Thanks so much. Have a great week.